My part is about the pathophysiology, etiology of the multiple sclerosis, and classification. This is the first part I'm going to cover with you. Let us first start with the overview about the multiple sclerosis. Is a chronic, frequently progressive neurologic disease of the central nervous system. Its etiology is not known, and it is uncertain trajectory. This disorder is characterized by the occurrence of small patches of demyelination of the white matter of the optic nerve, brain, and spinal cord, causing disruption of electrical messages from the brain to the peripheral nervous system. The multiple sclerosis mainly it is distinguished by exacerbation and remission of symptoms over the course of the illness. Moreover, the most common central nervous, it is one of the most common central nervous system disease among young adults and the third leading cause of disability in the US. The signs and symptoms of multiple sclerosis vary widely and depend on the amount of nerve damage and which nerves are affected. Even within the individual, you will find different manifestations. There is no cure for the multiple sclerosis. However, treatments can help speed recovery from attacks, modify the course of the disease, and damage symptoms, manic symptoms. Let us know what is multiple sclerosis. So here is the definition. Multiple sclerosis is a progressive, inflammatory, neurodegenerative, demyelinating disease of the central nervous system, predominantly affecting the white matter of the optic nerve, brain, and spinal cord, as you can see in the image here. I will just here you can see that the difference between the two nerves, the healthy nerve on the left side and the diseased one on the right side. The cell here, the axon, it is healthy, and the axon also, and the fiber and the myelin later, it is the myelin fiber, it is covering the axon. Here it is damaged, the myelin it is damaged, and so it will leave the exposed of the fiber, so it will lead to the problem. This is briefly about the how it will occur. Okay. Also, this figure will show here. This is a healthy. Sorry. In the upper part is a healthy cell, and below it is the damaged one. After the fiber, it is exposed, and the nerve will be affected, and it will result in the maltransmission of the impulses. Here, the lesion in the lower part of the spinal cord, as you see this red area, it is indicative of the lesion in the lower part. I will just pointed it, the laser here. Here is a lesion in the lower part of the spinal cord. This means that all the parts body beneath this lesion tends to be affected by numbness, tingling, pain. The patient may present these manifestations. Here are the plaques that results from the inflammatory reaction after this formation of this plaque. So there is an inflammatory reaction will take place, and there is scarring, we will see later. All this, it will tend to affect the transmission of the impulses. This slide here shows the prevalence of MS around the world. An estimated 2.8 million people in the world have multiple sclerosis. Research suggests the proportion of women with multiple sclerosis is increasing, and that roughly between 2 and 3 women have MS for every man with the condition. Also, the distribution of MS around the world is uneven. Generally, the prevalence increases as travel further north or southern, as it is clear here, in the upper part or in the northern side. Those parts of Asia, Africa, and America that lie on the equator have extremely low level of MS, while Canada and Scotland have the particular high rates, as you can see here in this global part. Also, the men are showing more ratio to the comparing to the men, and but for the prognosis, it looks worse in the men more than in women. The prevalence of the disease in the Saudi Arabia, the prevalence of MS has significantly increased in Saudi Arabia, but is still much lower than Western and other neighboring countries. In addition, Saudi Arabia's projected prevalence of MS through this national study is 31 to 55 per 100,000 population, putting them above the low risk zone at their current classification. This classification, my colleague, Mr. Rubin, he will explain it more for you. The prevalence was higher among female, younger, and educated individuals. Further studies, I think, needed to assess the risk factors associated with increased prevalence in Saudi Arabia. In the pathophysiology, we said that there is demyelination. So what we mean by demyelination, the destruction of the myelin, the fatty and the protein material that covers certain nerve fibers in the brain and spinal cord. Once this demyelination happens, it results in disordered transmission of nerve impulses, and there will be inflammatory changes, of course. So this it will lead to formation of scarring of the affected nerve fibers. As we said, the causes is unknown, but it considered an autoimmune dysfunction, genetic susceptibility, and infectious process, and or environmental factors, as we have seen in the prevalence. Continue the pathophysiology. There will be lesions include acute plaques with active inflammatory infiltrate and macrophagous and chronic inactive demyelinated scars. Like this here, as we have seen before in the same image, the formation of the plaques that tends to affect the transmission of the impulses. It is irreversible. There is irreversible axonal damage caused by the inflammation and demyelination and scarring. So unfortunately, it is irreversible. And also it may lead to brain atrophy, may be useful. This in measuring disease progression and effects of long-term therapy. As we said, the etiology is not known, but there are risk factors. One of those risk factors is the family history, so it is relatively genetic, and certain infections like Epstein-Barr virus infection that causes infectious mononucleosis, and also the age. It is considered to be around 20 to 40 years age, but also researchers found that it could happen before the 20 and it could happen after 40 years, but the majority of its occurrence is between 20 to 40 years. Vitamin D also considered as one of the risk factors. Low levels of vitamin D or low exposure to sunlight, it can increase the risk of the developing or getting the MS. Also, the gender, as we said, in women, it is more than in men. And certain autoimmune disease, it may also increase the risk, like the autoimmune disorders such as thyroid disease, pernicious anemia, psoriasis, type 1 diabetes, or inflammatory bowel disorder. There is also, as we have seen in the prevalence, white people are at highest risk of developing the MS, and smoking also increases the risk, and the climate. We come now to the classification of the MS. We have four classification for this disorder. The first one, it is known as relapsing remitting multiple sclerosis. Relapsing remitting means that it is the most common type of the relapsing remitting multiple sclerosis. Around 85% of MS patients. As you see here is a diagram Here, this arrow is it shows us the disability going vertically, and the horizontal axis is the time. By the time, how much is the disease? Here, in the beginning, it will start with the first manifestations that will appear, or with the demyelination. The patient will present with certain symptoms. Then it will give a relapse. More symptoms may appear. Then again, there is period of remission, or the patient decrease the symptoms. Then again, an attack or relapse. But you need to notice the difference between the basic here, the basic or the first attack, and say, for example, this is the first attack. There is widened between the basic line. This means that there is increase or development of new lesions that tends to give more manifestation or more disability with the time. By the time the patient may have some little free from the symptoms. The other type is secondary progressive MS. About 50% of the first type, the relapsing remission, patients will develop this over time. This is also characterized by starting of the symptoms, then relapse and remission, relapse and remission. Then the patient will progressively have increase in the disability or in the manifestation or clinical symptoms the patient will have. This is the second type. The third type is primary progressive. This type of MS is not very common, occurring in about 10 to 15% of people with MS. Males outnumber female. Onset of symptoms gradually worse with the time. As you see here, it is a steady or a straight line from it start the attack or the demyelination. The symptoms will start appear on the patient and increase gradually with the time, and the disability also will increase without any chance for the remission. The fourth type is known as progressive relapsing MS. A rare form of MS is about 5% progressive relapsing. It is characterized by a steadily worsening disease state from the beginning, with acute relapses but no remissions with or without recovery. And the patient will continue have the demyelination, the symptoms, the relapse remission, symptoms, relapse remission, and going on without any chance to for the recovery. It's a condition is continuously giving progressive disability. These are the four types of the multiple.
Amna?
Need you in the nursing management, but now I will leave the chance to my colleagues, special speaker, Dr. James and Dr. Robin. They will carry.
Okay, so I can share the screen, or I'm going to continue with this presentation. Okay, thank you very much.